The World Health Organization, WHO, has once again declared Mpox a global public health emergency. This marks the second time in just 2 years, underscoring the seriousness of the situation. But why has the WHO taken such drastic action? As of 2024, Mpox cases have been reported in several countries outside of Africa, with the majority of cases being linked to the Clade 2 virus strain. Some of the affected countries include United States, over 1,800 cases have been reported, with around 5 deaths linked to Clade 2. Australia, around 319 cases, with no reported deaths, also linked to Clade 2. United Kingdom, more than 200 cases have been identified, though the specific clade is not confirmed. Canada, at least 164 cases, with no deaths reported associated with Clade 2. Germany, over 85 cases have been identified, with 1 confirmed death, but the clade is unspecified. Argentina, at least 10 cases have been confirmed associated with Clade 2. These are just a few examples, but other countries like Sweden, Thailand, Indonesia, and the Philippines have also reported cases. The ongoing situation underscores the need for continued vigilance and global cooperation to manage and contain the spread of the virus. This new declaration comes on the heels of a disturbing outbreak in the Democratic Republic of Congo, DRC. What started as a localized health issue has now spiraled into an international crisis, with the virus spreading rapidly to neighboring countries. The implications are dire, and the urgency to act has never been greater. On Wednesday, an emergency committee met to discuss whether this situation should be classified as a public health emergency of international concern, PHEIC. WHO Director General Tedros Adhanom Ghebreyesus emphasized the need for a unified global response. The detection of a new strain of Mpox in eastern DRC, which has now spread beyond its borders, is particularly alarming. But what does it mean when the WHO declares a PHEIC? It's their highest level of alert, reserved for serious, unexpected health events that require international coordination. This status is a call to action, aimed at boosting research, funding, and response efforts. Past PHEICs include the devastating Ebola outbreak and the ongoing COVID-19 pandemic. As Mpox spreads, the Africa CDC has also declared a public health emergency for the continent. In response, Dr. Jean Kaseya, Director General of Africa CDC, announced an ambitious plan to deploy 23 million vaccine doses across Africa. The first 10 million doses will be distributed next year. These vaccines are crucial in containing the outbreak and preventing further spread. The WHO is also stepping up its efforts, releasing $1 million from its contingency fund for emergencies. They are urgently seeking an additional $15 million to enhance surveillance and response activities. This is a race against time to contain the virus and protect vulnerable populations. 2 vaccines have been approved by national regulatory authorities and recommended by WHO's Strategic Advisory Group of Experts on Immunization, SAGE. These vaccines will be distributed through Gavi and UNICEF, with the emergency use listing process already underway. Vaccination could be the key to preventing further international spread. But how does Mpox spread? The virus can be transmitted through direct contact with an infected person's bodily fluids, sores, or respiratory droplets. This can happen during close physical contact, such as cuddling, kissing, or even sex. Additionally, contact with contaminated materials like clothing or bedding can also lead to infection. Mpox can also be contracted through contact with infected animals. This includes being scratched or bitten by an animal, handling or consuming meat from an infected animal, or coming into contact with an animal's blood or sores. The virus is highly contagious, and even a small lapse in hygiene or precaution can lead to infection. The symptoms of Mpox. Once exposed to the Mpox virus, symptoms typically appear after an incubation period of 1 to 2 weeks. The early signs of infection resemble the flu and include chills, exhaustion, fever, headache, and muscle aches. Swollen lymph nodes are also a common early symptom. Following these flu-like symptoms, a distinctive rash develops. This rash can appear on the face, inside the mouth, and on various parts of the body, including the hands, feet, chest, and genitals. The rash may look like pimples or blisters and can be quite painful. Some people develop the rash first, while others may experience the rash alongside flu-like symptoms. The rash undergoes several stages, starting as pimples or blisters and eventually crusting over and falling off as they heal. The illness caused by Mpox typically lasts between 2 to 4 weeks, but the severity of symptoms can vary from person to person. Monkeypox diagnosis. To diagnose monkeypox, healthcare providers typically take a swab from a skin lesion and send it to a lab for polymerase chain reaction, PCR testing. This test is crucial for detecting the virus and confirming an infection, especially in areas where the virus is rapidly spreading. While most people with Mpox recover on their own within 2 to 4 weeks, managing symptoms can make the illness more bearable. Drinking plenty of fluids, resting, and taking warm oatmeal baths can provide relief for the dry, itchy rashes associated with the virus. Over-the-counter pain relievers and fever reducers can also help ease discomfort. Currently, there are no treatments specifically for Mpox. However, because of the similarity between Mpox and smallpox viruses, antiviral drugs and immune globulin therapies developed for smallpox may be used to treat Mpox infections. For those experiencing severe symptoms, these treatments can be life-saving. If you have Mpox, it's important to talk to your healthcare provider about your eligibility for treatments like the antiviral drug tecovirimet. When to seek medical care. If you experience symptoms such as fever, aches, swollen lymph nodes, or develop a new rash or sores, it's crucial to contact your healthcare provider immediately. If you've been in close contact with someone who has Mpox, you should also seek medical advice. In more severe cases, symptoms like a stiff neck, chest pain, confusion, difficulty speaking, or seizures can occur. If you or someone you know experiences these symptoms, it's vital to seek emergency medical care right away. Anyone can contract Mpox, but there are steps you can take to protect yourself. Avoid close contact with individuals who have been diagnosed with Mpox or who exhibit signs and symptoms of the virus. This includes not sharing bedding, towels, or utensils that may be contaminated with the virus. It's also important to clean and disinfect high-touch surfaces regularly. If you must be in close contact with someone who has Mpox, wearing a mask that covers your mouth and nose and washing your hands frequently with soap and warm water can help prevent transmission. Remember, Mpox can spread from the time symptoms first appear until the rash has fully healed. If you suspect you have Mpox or have been diagnosed with Mpox, there are crucial steps you should take to prevent spreading the disease to others. First and foremost, if you have an active rash or other symptoms, isolate yourself in a separate room or area away from other people or pets in your home. It's essential to stay at home until all your skin lesions have scabbed over and your other symptoms have resolved. This is to ensure that you're no longer contagious. If you must be around others during this time, wear a mask that covers your nose and mouth to minimize the risk of transmission. Vaccination is another critical tool in preventing Mpox infection, particularly for those who have been in close contact with an infected person or who are at high risk of exposure. 2 vaccines currently licensed by the FDA to prevent smallpox, JYNNEOS, also known as Imvamune or Imvanex, and ACAM2000, can also be used to prevent Mpox. However, the availability of these vaccines is limited. JYNNEOS is currently being targeted for use in people who have been exposed to Mpox or who are at very high risk of exposure. ACAM2000 is available but requires special handling and administration, making it unsuitable for many individuals, including those with certain skin conditions, pregnant women, or people with weakened immune systems. The limited supply of vaccines is being distributed through local health departments, select clinics, and health systems for eligible patients. If you believe you may be eligible for vaccination, it's important to contact your local health authorities for more information. Clade 1 is particularly concerning because it is more transmissible and capable of causing more severe symptoms than Clade 2. Infectious disease experts are deeply worried about the potential for further international spread, especially given how quickly the virus has moved from the Democratic Republic of Congo to other regions. The rapid spread of Clade 1 highlights a crucial point. An infection anywhere is potentially an infection everywhere. This is a reminder that infectious diseases do not respect borders, and global vigilance is necessary to protect public health. The situation is further complicated by the fact that Mpox can spread through both human-to-human contact and from animals to humans. This zoonotic aspect makes it even harder to control, as it requires coordinated efforts across multiple sectors, including wildlife management, public health, and international travel. Mpox is not just a regional issue. It's a global health crisis that requires immediate and sustained attention. The rapid spread of Clade 1, the severity of the symptoms, and the ongoing challenges in vaccine distribution all contribute to the complexity of managing this outbreak. We must learn from past experiences with infectious diseases. The lesson is clear. Proactive measures, timely responses, and global collaboration are essential to preventing further spread and protecting lives. Stay vigilant, stay informed, and most importantly, stay healthy. See you next time.